The Biden administration paid corporate media more than $1 billion to promote the COVID shots, stating they were safe and effective. But the facts are unfolding that they are certainly not. And those organizations like the CDC, NIH, and FDA that are supposed to protect your health have a very different agenda. Welcome to Freedom Alive. Dr. Ryan Cole is a board-certified pathologist and owner and operator of the largest independent testing laboratory in Idaho. Dr. Cole's lab processes and reports out approximately 40,000 blood and biopsy patient samples annually. In the last year, the lab has handled over 100,000 COVID testing samples. Matt, Dr. Cole performs autopsies on many people who have received the COVID shots and studies their organ tissues under a microscope. And what he's finding is shocking.
Yeah, I can't wait to share his interview with the viewers of Freedom Alive, because he has obviously been in this business of looking at tissue samples and blood for many years before COVID, after COVID, during COVID, before the shots, now during the shots, and he sees this incredible difference about what it's doing, these COVID shots, to your blood and to your organ tissue. And he's going to share that about what he finds and what he has seen in his samples.
I agree. A fascinating, startling story coming up next. But next is our Freedom Alert.
Graphic designer fears for her life as her free speech case goes to the High Court. I'm Matt Staver, co-host of Freedom Alive. Lori Smith started her own website design firm in 2012 called 303 Creative. But 4 years later, Lori declined to create a design supporting a same-sex marriage message that violated her sincerely held religious beliefs. A Colorado public accommodation law was being used to force her to create messages that she and other Colorado residents did not support. Now she is challenging the law and going to the U.S. Supreme Court this fall. Liberty Counsel has filed a friend of the court brief in the case. Please pray for Lori Smith and her clients. They are being harassed and they are receiving death threats from activists seeking to suppress her Christian beliefs and destroy her business.
Thanks for that Freedom Alert, Matt. Up next is Matt's interview with Dr. Ryan Cole.
Well, our very special guest to Freedom Alive is Dr. Ryan Cole. Welcome to Freedom Alive, Dr. Ryan Cole.
Thank you, Matt. It's an honor to be with you today.
It is really an honor to be with you, and we have certainly followed your work. You have been a major voice with regards to the COVID shots. I want to give the background to our viewers about your education, your training, your specialty before we move into the specific topic.
Sure. I'm a Mayo Clinic trained pathologist, board certified in anatomic and clinical pathology, served as the chief fellow at the Mayo Clinic, my surgical pathology fellowship year after those years of anatomic and clinical pathology. Then I went on to fellowship in dermatopathology through Columbia University. I've been an independent medical lab director for 2 decades in Boise, Idaho. I run one of the largest independent labs in the Pacific Northwest, and I see a lot of biopsies. I've seen 500,000 patients diagnostically in my career. I also did some early PhD work in immunology. So immunology, virology, pathology, it's all in my bailiwick.
So with regards to your work, you looked at tissue samples, blood samples, and so forth, both pre and post-COVID, pre and post the shots. So you have this before, during, and after picture of what tissue samples would look like normally, blood samples normally, and now what you're seeing with regards to the tissues and blood samples. One of the things that you have been a world leader in is what's called immunofluorescent staining. Tell us what that does with regards to your specialty.
Certainly. So under the microscope, any given tissue slide, we look at cells and a lot of cells. And traditional microscopy, we just use 2 colors, kind of a pink and a blue-purple. And so you can contrast just basic cell features with that. Oftentimes when we see an inflammatory condition or a tumor condition, sometimes you have to see what is the cell expressing. So all of our cells on their surface will express different proteins. We use very special chemical stains that are very specific to very individual proteins. And so we can stain this tissue slide. We maintain the tissue blocks, which are embedded in paraffin, and they're permanent for 100 years. So I can go back and take any piece of tissue, use some very specific markers, and it will make those specific proteins glow. So we can look for either the presence of a protein, and that can tell you what type of cell, what the origin of the cell, or what type of microbe, or what type of protein is present. Present. A very uh, a very technical but a very common procedure in pathology to try to tease out what certain cells have in them or on them.
So you can have tissue that is absolutely preserved from any exterior contact, but then you can superimpose on the outside of that glass covering or that casing some kind of other stain, and that stain will then alert you to what kind of protein is in that particular tissue?
Yeah, so we can see exactly what that cell is expressing or what an invading species is doing to that cell. So we can look either from the human side or from another invader or pathogen. So we can see what the pathologic process is. So what we're doing in pathology, we're the quality control of medicine. We're looking for patterns. And there are very specific patterns that we see over decades and even centuries and very known things. But once something novel or new comes along, we use these special protein stains and markers to highlight and try to find out what's new and different in these patterns.
With the kind of staining that you're able to do and look at proteins, are you able to detect, for example, a spike protein that might be created as a result of one of these COVID shots?
Yes, the short answer is yes. So we can look very specifically not only for the spike protein, we can also look for, does the patient have a natural infection? So we can stain either what's called the nucleocapsid that covers the RNA. So there's a very specific stain that will hone to that, bind to that, and then we use a little chromogen, which means it lights it up, and then we can see it under the microscope. So we can look for the nucleocapsid from a natural infection. But if the patient only has spike posited, say from the shot, and doesn't have a natural infection, then we see just the spike and not that nucleocapsid. So we can literally tease out vaccine spike versus infectious spike.
So let me be really clear here for those that are watching. Based upon your diagnostic pathology, you're able to determine whether somebody has in that tissue and or blood natural infection from COVID or some kind of exterior injection, one of the COVID shots that they have received. You can make the distinction between natural versus the COVID shots.
Yes, and I mean, there was a very good paper from Dr. Roltgen at Stanford in the journal Cell just about 2 months ago. And if one wants to go online and look at the paper by Dr. Roltgen, you can see where they looked at tissue from the lymph nodes, and they could see the individuals that had received the shot still have within their cells that sequence of mRNA from the shot, which is still making spike protein. So there's some very good highlighted photos there. And they did a comparative of infected individuals versus those that had just received the shot. And so we can absolutely tell that difference.
So on some of the samples that we're going to be looking at, both on the screen and in your own facility there that you're going to show us, what you're actually going to see on the screen for the viewers and what you're going to show us, that is directly related to the shot itself and not to COVID in general.
Correct. The spike has a propensity to cause a lot of clotting. So early on in 2020, we saw a fair amount of clotting reports in the literature from natural infection. But after the shots rolled out in 21, we saw a marked increase of clotting because these shots make your body make this toxic inflammatory spike protein, which in and of itself can cause excess clotting in manners that are very unique physiologically. These can cause clotting in the absence of platelets. These can cause clotting in manner that we haven't seen before. And this is verified by some what we call thromboelastic studies from Dr. Pretorius in South Africa. And she's been a pioneer in figuring out why this spike protein causes so much clotting. And these are very, very unusual clots because of the manner of mechanisms compared to what we're normally seeing in the human body over eons. This is something novel and new that shouldn't be happening. And we're putting into the body a sequence that is thrombogenic. It is clot causing, which is highly, highly, highly concerning. One of the reasons why all these shots need to be stopped right away. In fact, part of the reason that the FDA just said J&J no more, but the irony, is J&J certainly caused clotting, but in the VAERS systems, Moderna and Pfizer cause more clotting. There's more adverse events reported from those two shots than J&J itself. And meanwhile, the FDA halted J&J. It makes no sense.
It makes no sense. So what are you seeing? As a layperson, we think of a blood clot as various different kinds of things that we have conceptualized in our mind. But in what you're seeing, what is the clotting that is happening as a result of the shots that you're seeing in these pathological reports?
So clotting is a normal process. We want to be able, if we have a vessel injury or if we have a scrape on the knee, you want to be able to clot and stop the bleeding. What you don't want is clots to form and to continue to get larger and larger and larger and block vessels. So sometimes you'll hear about an individual on an airplane sitting for too long and they may form this little knot in a vein in the leg, a deep vein thrombosis. Well, the risk of that is it can unlodge itself, go up, through the portal vein, through the liver, up into the lungs, and all of a sudden block the lungs and cause a choking off of circulation. And now you can't breathe and you can die very quickly. What we're seeing with the spike-induced clots is not only are they causing these larger clots, but they're causing microclots throughout tiny vessels throughout the entire body. And this is, again, the propensity of the spike to cause this process. So under the microscope earlier with the shot rollout, and even with COVID, we were seeing some of these microclots, and after the shot, seeing more of them in skin biopsies and gastric biopsies, in tissue from anywhere in the body. And we expect to find a little clot every now and then in certain inflammatory conditions, but to find them constantly and more consistently is a new pattern, and that, again, is a concerning pattern.
Before we go to what you actually have before you, Dr. Cole, I want to bring up a couple of photographs that you have provided from what you are seeing. These are clots. There are measurements, a measuring device, so you can see how long they are. And on one of the photographs, you have a blue glove, and the clots are in that blue glove hand. When I think of a clot, I think of something small, like a BB or something like that, that would block the blood vessel in the artery. But what we're looking at here, I would have never imagined that this would be a blood clot. Explain what's happening.
Yeah, and this is the problem with this spike protein is in order to clot, normally you have this little waterfall cascade of clotting factors that need to trigger this, triggers that, triggers that, triggers that. What the spike will do in the absence of these clotting factors and even in the absence of platelets will cause red blood cells and proteins to just clump together. And instead of that little BB clot or a little marble clot, these are forming long worms and snakes because they keep compounding on each other and then just form this long flap attached to a vessel wall. And these are anywhere from an inch long to 6 inches to 12 inches. Some of the morticians and coroners that have sent me some of these, they can be 2, 3, 4 feet long. So, and I've heard countless patients in the ICU with an entire vein in the arm, just rigid and firm with one giant clot. And so when the morticians go to actually put their embalming fluid in, normally they're able to flush the blood out and put preservative fluid in when they're preparing the body. But what a lot of morticians were finding is they were getting this back pressure they'd never experienced before. And what that was these long, thick, rubbery We call it an amyloid-like protein, which is not a normal clotting substance. They're firm, they're rubbery, and this is why clinically hospitals and doctors are having trouble breaking these clots down because number one, they don't form in a normal manner, and then number two, they don't break down in a normal manner either.
Mm. Now, there was some information that you provided that these mystery blood clots, or these unusual blood clots that you're seeing, they're being detected in up to 93% of some of the embalmer cases. That's a staggering amount. In other words, what they're seeing in these autopsies is staggering number of people that are coming in with these unusual clots that I assume you've never seen anything before like this in your practice before the COVID shots came on the scene.
Absolutely correct. An occasional clot is not unusual, but to see it at this percentage is highly unusual. And I kind of coined the term clot shot over a year ago. And I knew some of these processes that were already occurring. And it's very frustrating that we're continuing to use a product that is causing clotting at rates we've never seen societally before. I have about 30 of these that have been sent to me from around the country. Here's one right here, and all that white rubbery, all of that is an unusual rubbery protein clot that was filling an entire vessel in a deceased patient. And you can't get blood around this, let alone oxygenate the tissues around that vessel. So some of these are in the veins, but more importantly, on the screen, one of those long ones that was over a foot long and kind of darker and coily came out of an artery. And so you can imagine these patients are forming these in numerous vessels around the body, both large and small, and that's the big concern.
In addition to these clots, Dr. Ryan, what else are you seeing? I want to ask that question. I also want to find out, how long does this last? So for example, somebody has a COVID shot, but they don't have an immediate reaction. How long after are you seeing these COVID shots causing these kinds of clotting?
That's a great question. A long time. So the Stanford study showed that spike present and that mRNA sequence present for up to 60 days after the shot. And they stopped their study at 60 days so they could publish. Now, my colleague, Dr. Burkhardt, who's in Germany, who's done some autopsy studies, he showed persistent spike deposition from the shot in blood vessel walls 128 days after a shot. So normally when we hear about an adverse reaction from a traditional vaccine, most of those deaths happen within the first week or two. So we were gaslit early on saying, well, if it happens 2 weeks after, it can't be the shot. So some of these famous individuals that you heard that died suddenly, oh, it couldn't have been the shot, it was too far out. This is a new product that is a gene-based replicative process, replicative nuclear sequence that continues to make its product, a toxic spike protein. So really these adverse reactions and clots can continue to form 2, 4, 6 months after the previous shot. We don't know when this mechanism turns off.
And do these clots get worse after, say, the first, the second, the third, fourth injection, the boosters?
Yeah, so it's a dose-dependent curve. And so when we look at true toxicology studies in medicine, most toxicity or poisoning is dose-dependent. So if you get a little bit, you may have an adverse reaction, but if you get more, it becomes worse. If you get more, it becomes worse. And we know because of how long this spike and this sequence persists, you keep compounding on an underlying problem that's already been created. So that's why this sequential finding of more clots and more sudden death and more cardiac arrest and more cardiac inflammation continues to happen more after that second, third, and fourth shot. So the lesson there is, don't get another dose of a poison if you've already been poisoned.
Absolutely. In addition to these clots that are startling, what are you seeing with regards to other kinds of health conditions that occur that are unusual that we're now seeing after someone has gotten the COVID shots?
My biggest concern is the immune suppression that we're seeing. So this spike protein can get into the nucleus of our T cells, one of our very important white blood cells that fights off infection. And when it gets in there, it inhibits the ability for the DNA to repair itself, which leads to one of two things. Either that cell dies off or it can become mutated. The other thing it does is it tunes down or blocks the number of T cells that we have active. So we have very important cells called natural killer cells and CD8 killer cells. These cells fight off infection. These cells, importantly, also fight off cancer. These are like the Marines of our immune system, shaking hands with every cell in our body all day long. You and I sitting here have about 30 billion circulating T cells. Their job is to surveil our system constantly. And if there's an atypical cell or a pathogenic invader, those cells normally will throw in a little hand grenade and blow up that atypical cell. The number of these cells is going down. Now the Marines are drunk at the back at the barracks instead of out on the front lines fighting. And this is the problem. So we're seeing an uptick in cancers, not because it's making the cancer more aggressive, but because of the mechanisms that would keep that cancer in check. They've now been decreased and weakened.
We are hearing that we're not medical doctors, but we're in touch with a lot of doctors like yourself and others around the country and around the world, and we're hearing the same exact thing. People, for example, healthcare workers that were required to get the shot, and they succumbed to that pressure and they got the shot, they're getting these unusual cancers, or cancer that is very rapidly progressing. So not only are they getting the cancer, but their body can't fight that cancer effectively. And so it's very rapid. Many other things as well are happening in addition to cancer. With regards to the clotting, the cancer, the other side effects that people are having, the hepatitis now that we're seeing is this new phenomenon, for example, among young people and children. What can a person do? What's the best course of action for a person to do to address the clotting risk, all the other side effects, the reduction of T cells and so forth? Once they've already had one or two or more of these shots, what can they do to try to ameliorate to the best as they can possibly do the results of these COVID shots?
That's a great question, and we're still trying to figure a lot of those answers out in medicine. Number one, don't get another shot. It's the wrong protein, it's the wrong shot for the wrong virus. The shots have never been reformulated. The Wuhan variant went extinct in humanity over a year and a half ago. The shots don't cover Omicron. So now the shots are literally all risk, no benefit. So number one, don't get another one. Number two, if you've got some of them, I'm not here to judge. I'm here to report what I see. Optimize your vitamin D level. Vitamin D can help optimize the communication between your immune cells. Vitamin D in low levels is associated with 17 different cancers. Vitamin D in low levels is associated with worse outcomes with COVID. So that's a very simple one. Number two, most people aren't hydrated. If I put a needle in 100 people's arm anywhere in the world right now, 75 would be dehydrated. So the majority of people don't hydrate enough. And that can lead to clotting conditions. One can take low-dose aspirin. The irony is in the news, you see all this advice from mainstream media, oh, don't take aspirin, when we know it's one of the things that inhibits some of these clotting pathways. And another enzyme that's used very often in Japan is called nattokinase. They eat a fermented soy product called natto, and it breaks down fibrin clots. They have a very long-lived population in northern Japan that don't die from heart disease and strokes. So there are certain natural products that can help break down some of the fibrin clots. The other thing, too, is very basic things. People don't sleep enough. When you don't sleep enough, your immune system actually weakens. Your cells become less sticky and can't talk to each other. Making sure that one doesn't eat an inflammatory diet. Sugar is very inflammatory. High fructose corn syrup actually inactivates your vitamin D, and it's inflammatory. There's so many things we put into our body that actually alter and suppress our immune response. So taking care of one's basic health, looking in the mirror and realizing you're the best doctor you'll ever have, and realizing you can do things that will optimize your health that can minimize some of these atypical physiologic pathways. There are, some of the medications, which shall not be named, that actually help block this spike protein and block the clotting as well, which is very interesting. We've been looking at some of the vaccine-injured individuals, and we put them on certain medications, and they get a lot better. So there are some of the controversial meds, but the reason they work is they block that spike protein.
Are you referring to ivermectin, hydroxychloroquine?
Yes.
I wanted to name them.
Yeah. And ivermectin is an excellent spike blocker. And another one as well is, you can get it at health food stores, is cumin flaxseed oil. It will bend the spike and inhibit it from binding to our ACE2 receptors. So yes, those will inhibit spike binding.
In our final 30 seconds, Dr. Cole, what final words would you want to leave our audience with?
I want to emphasize that we need to come back together in community. We've been very divided societally. This is not about one group being right or wrong. This is about saving humanity. Let's come back together in community, communicate, love each other, help each other, try to see the good in the world, and make the world a better place by all doing our part together.
Well, thank you, Dr. Cole, for sharing your practice, your experience, and your wisdom.
It's an honor. Thank you so much.
Thanks, Matt. That was a fascinating interview. I just feel really thankful that we're able to bring, for those at home, guests like Dr. Ryan Cole.
Yeah,
this is just remarkable. His experience, his proficiency, his findings.
His findings are absolutely shocking. And his expertise in being able to make these decisions and look at what we saw him present are startling. That's the kind of information that ought to be on all the media across the country, frankly, around the world, because people need to be aware so they can make their informed decisions. Problem is that that kind of information is being censored. Dr. Ryan Cole is being censored. Others like him are being censored. But it is indisputable where he says that he, from his medical pathology expertise, can make a distinction between a spike protein in a tissue or a blood sample created by COVID versus a spike protein created by these COVID shots, and they're exponentially different. And then he sees the results of what's happening with these COVID shots. That's information that ought to be shouted from the rooftop and from the media all over the country and around the world. But thankfully, we're able to bring this information here on Freedom Alive.
Exactly. We feel blessed to bring you guests like Dr. Ryan Cole. It's our goal with every episode to share hope, peace, light, and truth. God's word says in Proverbs 2:12, wisdom will save you from the ways of wicked men, from men whose words are perverse. Well, that's it for today. But be sure to tune in next week, where we will update you on existing battles and alert you to new government overreaches. We'll tell you about the victories people of faith are winning and how you can fight back and stand up for your priceless freedom. Join us again for Freedom Alive.